guys, this is your host, Valkyrie Rain, and we are here on another Industry Insight segment. So, in honor of National Nurses Week, I have with me a registered nurse, a proud Haitian American, a distinguished member of Alpha Kappa Alpha sorority, and Portia Williams' doppelganger. Welcome to the parlay, Sabrina Monae. Hey, how are you?
Hey.
I mean, you look like Portia look like you. I don't know, like you could step in.
She's a beautiful woman, so
She is.
I don't mind the
Comparison.
Yes, I don't.
And you're in Atlanta, so fun facts. I'm sure people have told you. Is that Portia?
I mean, honestly, I get it more on social media than I do like living in Atlanta.
Really?
Yeah.
It's probably because they actually know where she be at.
Yeah, they probably. And I don't got the booty, so they know what she look like physically.
Dead, that part. Them Africans just pull up, be like, right. Get a portion, a little something. But yes, thank you for coming on the Parlay Industry Insights. Registered nurse, and I see you here in your green.
Yes, ma'am.
Okay.
Always gotta represent.
Always and forever. So yes. So how long have you been in the nursing field?
So I've been a nurse in totality for 6 years.
Wow.
Yes. But I've been a registered nurse for about a year and a half now.
Okay.
I started off as a licensed practical nurse, and then I went back to school and I got my registered nurse. So
of course.
In totality, it was 6 years.
There you go. Total, yeah. And COVID didn't scare you away?
No, actually, COVID was a time. I think that was a huge learning experience for me because during the COVID time, I was still a baby nurse. I was like 2 years in. Mm-hmm. So I still consider myself a baby nurse because I was still learning the ropes as well.
Right.
Nursing is a continuous learning field where you're always learning. Every day you're learning.
Yeah.
And even though you have the years of experience, and yes, you have the experience, but it doesn't take away from the fact that every day we're learning something new. So during those 2 years, I still kind of felt like I was a baby nurse because I was still learning stuff. And then we have this big pandemic. So I could imagine the nurses that were just graduating going into that.
Right.
But you have this big pandemic and you're just like, what am I doing?
It was like epidemic. And here in New York, like the Javits Center, laying bodies. Yes. And I just had moved here and I was just like, whoa. But kudos to you. COVID didn't freak you out of.
Atlanta didn't close, so.
Yeah. Clearly. The South was wild. Like everybody was outside.
Atlanta
oh my
did
gosh.
Not close.
That's crazy.
Did not close.
So tell me, what brought you into the field in general? What made you want to become a nurse?
Honestly, I knew what I wanted to do since I was a kid. Like I knew where I was going since I was a kid. My mom's in the field, my aunt's in the field. You know Haitians.
Hey, I was just about to say Haitians. That's that top three. Evoca, accountant, lawyer, engineer,
doctor.
I mean,
so like we have, especially in my immediate family, like cousins and stuff like that, we have people in the medical field. So it's always something that I knew that I wanted to do. It was basically about when am I going to get there?
Gotcha.
So my mom was in the field and going to work with my mom sometimes and listening to her talk about her job and stuff like that, that always inspired me. I was in a medical academy in high school.
Yeah, you were.
Yeah, that's why I left Wellington.
Yeah, that's why you left.
Yeah.
Boy, oh boy.
Yeah. So I was, it was always, and honestly, if you know me and my personality and how I am, it's the only job that I really felt like I could do.
A nurturer.
Honestly, that's just how I am naturally. So I feel like that was literally the job for me.
Yeah. Mm-hmm. And I feel like it takes a special type of person to like step into a hospital. Like,
absolutely.
I'm too sensitive.
Yeah.
As soon as I step in and I could smell the death. Yeah. I was like, I can't.
And honestly, because you have to think about it, like we're dealing with patients and a patient could die in one room. And now I've switched gears to where I work now. I work in ICU.
Oh, wow.
So, yeah. So patient coding in one room. We finished the code. Patient might have passed. We turn around. We still got other patients to take care of.
Exactly.
So we got to turn around and go to the next room and just talk to the patient like nothing just happened. Meanwhile, they can hear the code going.
Right.
But they don't know we were in the code. You know what I'm saying? So we got to act like nothing happened to the next patient. So it's just like, it's you do have to have a certain type of wall of strength, emotional maturity as well.
Facts.
Because you have to be able to keep the ball going.
Yeah.
Because you have other patients that need your help, especially in the ICU.
Facts.
You have other patients who are critical as well. So you can't be stuck on that.
Absolutely.
So yeah.
And I recently interviewed one of my nurses at my weight loss clinic. I interview everybody, child. I should have been podcasting. But she informed me that you nurses are the ones who take care of the dead body.
Yes.
And that is an industry insight that nobody knew.
Yeah.
Like, I thought it was like you call the morgue, the morgue has an assistant.
No.
So
all the morgue does is pick up that body.
But you guys literally zip them up. And I could just imagine, like, how many patients do a nurse would typically see in a day?
So it depends.
On a
so
shift?
For me, being in the ICU, I'm typically taking care of 2 to 3 patients at most.
Okay.
Coming from med surge, I'm at 5 to 6 patients, depending on what shift I'm working, right?
Right.
So granted, I worked in a surgical unit, so some of my patients were in and out. So if my patient's out, I'm getting another patient. So I could see up to 6 to 7 patients a day.
And have you guys suffered staffing issues?
Of course.
All day, right?
That's like nursing 101. You know that wherever you go, you're going to have staffing
Well,
issues.
I personally feel like these nurses outside traveling.
And that's another reason too, because if you going to have me without staff, you're going to pay me for that, right? So travel, nursing, you're going to get that money. And it makes it worth it in a sense, right?
Okay.
And also a lot of times, you have that typical, travel nurses get the worst assignments in a sense, So it's just like, if I'm going to get the worst assignment, if you're not going to have enough staff for me, pay me for it.
As they should.
I'm always for pay me for it. You want me to do this? Pay me for it.
Okay. Now, how would you advise anybody looking into coming into the nursing field? Kind of like what you spoke on earlier, having that mental fortitude. Like, what are some steps that you took?
See, I don't want anybody to think that, like, I don't want me to shy people away, think it's going to be scary.
Yeah.
I think you have to have the passion for it. That is so important.
Passion
Having
over
the passion over money, because there are times where you're going to feel like you're not getting paid enough. Nurses do not get paid enough. We don't. Let's be frank.
Yeah.
Nurses do not get paid enough. But, some hospitals you'll be going through more than others will be, right? So, and sometimes you might have to just bite the bullet. There's instances where you just have to bite the bullet. So you have to be passionate for it. And patients will see that on you. Like, do you really love your job?
Yeah.
You understand what I'm saying? Like, when you go in the patient's room, some of these patients are scared for their life.
Right. The anxiety is intense.
You can't go in there and just treat them like a stranger. You got to treat them like your mama. You got to treat them like your cousin.
Yeah.
You know what I'm saying? Like, you can't just go in there and just, here's your meds.
Right.
Let me listen to you.
Now, you touched on it. Nurses don't get paid enough.
No, they don't.
Also, I mean, I work in the healthcare field in the dental world, but assistants do way more than the doctors.
Yes.
So I already know nursing, you guys do more than the doctors.
We have to think, because we have to anticipate a lot.
Yeah.
Right? So we have to see what's going on and anticipate what could be happening, so that when we present it to the doctor's able to get to that solution quicker.
Right.
We can't just wait for the doctor to go in, assess the patient, figure it out. No.
Right.
Hey, this is what I'm seeing. This is what's going on. This is what I think is happening. And then we go to the doctor and we tell them that. And they're like, okay. Then they'll look at the patient, and half the time they agree.
Yeah.
And
so you do all the triage.
Yeah, absolutely.
For sure.
Absolutely.
Now, do you feel like the education for a nurse is very necessary to know all these things?
Absolutely.
Like, is that because I see all my friends going through nursing school and going through it, but once they get there, how was that like
hazing.
for you? Yeah.
Nurses, I always say, I feel like sometimes the rigorousness of nursing is kind of OD, but also I get it though, because you have to have some type of strength, right? If you're able to get through nursing school, you have some type of strength to be able to be in this world, because this world is not easy. Nursing is not easy. Like, I remember being a baby nurse and having anxiety all the time going to my shift.
Yeah.
Because I don't know what's going to happen.
Right.
You know what I'm saying? So it's just like, it's not easy. So if you can make it through nursing school, you have some type of strength to be able to endure through what nursing is, until you get that experience, until you get that comfortability, like until you get there.
Yeah. Now, what do you think about this little scandal? South Florida, where we're from, this little scandal about over 7,000 fake licensing degrees.
So imagine me from South Florida, got her first nursing degree in Fort Lauderdale, right? I got my LPN in Fort Lauderdale with my licensure.
Yeah.
In Fort Lauderdale. So it's just like coming from there. And during this time, I was an LPN.
Yeah.
And I'm like, I promise you, I went to school.
Right.
I think that ethically it is just so horrible. You know what I'm saying? From the people who started it, from the people who took advantage of it, right?
Yeah.
Because you have people who put in that work.
Yeah.
Nursing school, a BSN is the hardest degree to obtain in undergrad.
Facts. And she got a cum laude.
Cum laude.
Cum laude.
Absolutely.
Period.
So it's one of the hardest. So the thing about it is, it's just like for you to just skip all of that, it makes a mockery of what nursing is.
Right.
And I feel like that climate has changed too. There's a lot of mockery of what nursing is. And it's almost not as serious as it used to be, right?
When COVID happened, everybody cared about the essential workers who've always been essential, but no one knew.
Always been.
Right?
I remember I was in Publix during COVID and I had on my scrubs. This lady let me cut her just because I was a nurse. Thank you for all you do. Thank you. But
appreciate it.
We've been doing it.
Yes. You touched on it earlier before about being a baby nurse and having the hierarchy in the nursing system. How do you feel that young nurses coming into the field are treated when it comes against the case managers and the older senior nurses? Is there a dynamic shift there with this new generation of nurses?
I can't speak for others. I've heard it a lot. I've heard about it. I've heard people have gone through it and stuff like that. I've never gone through that, right? But also my route to where I am today isn't the typical route that most people go through, right? I didn't have a registered nurse residency where most people do, right? Because I was LPN first. So when I got into the hospitals, they did a short LPN residency, which is essentially just, this is how the hospital does it. You're already a nurse. This is how the hospital does it. LPNs don't have residencies. So I got that. And then when I got my registered nurse, I went through orientation of, now you couldn't do this, now you can do this.
Gotcha.
That was it. But I do hear it. Me, I don't do that. If you know your stuff, I'm gonna help you.
Perfect.
That's just that.
Yeah.
I don't see baby nurses coming in as any less than me.
Yeah.
But I do hear that.
Right.
I've seen it.
Because you're a millennial. And even in the workforce, Gen Z is a whole different animal. So do you notice a difference between Gen Z nurses versus yourself versus Gen X nurses?
I think I'm looking at it as just somebody who's older, right?
Yeah.
When I was their age, how was I acting, right? And that's how I look at it. Like
making TikToks at the nursing station. Child, somebody coding.
Somebody coding you on TikTok. But I don't... I feel like it's a mindset thing.
Yeah.
It's a mindset thing. I don't look at people who are younger than me of less than. I don't look at people who are less experienced than me as less than. If you know your stuff, I love you.
Yeah. Do you ever think your age is something that works against you in the medical field when it comes to dealing with patients who aren't quite sure if you're medical?
And that's another thing with nursing. You have to be assertive. You have to be somebody who's assertive. I never had to experience that. And granted, all the time they think I'm a baby. Like, oh, you must be 25. I'm like, no, I'm 31.
The melanin be popping though. Subtract
like,
5.
No, I'm grown, I promise.
Yeah.
I promise I'm grown.
Yeah.
But I feel like they push older because of how I am.
Yeah.
You have to be assertive. You can't go in that room and think that, you're not running that room.
Right.
This my room. Okay.
Right.
We gonna do how we do it. Okay.
Exactly.
I'm gonna take your part of the treatment, but you don't run the treatment, if that makes sense, right?
Yes.
So it's just like I don't really experience that because you have to have some level of assertiveness because they will eat you up if they find out you don't know what you're doing.
And especially if you don't get that line, that pick the first time. I've been poked a few times. And
they will tell you. They will snitch on you. Yeah, she poked me by 6 times. And when the next nurse come in, that last nurse didn't know what she was doing. It's just like, some people need to be poked a few times before we get it. It's okay.
Yeah. I mean, I stay chronically dehydrated, so I get it.
Exactly.
So I already know.
Exactly.
I'm like, just go for the right here. And, I also feel like when it comes to trusting, when you have like the nurses who are shadowing the other nurses or the doctors, and especially I feel like they do that a lot in hospitals if you have Medicaid or you don't have private insurance or, and I feel like that's something that a lot of regular people don't know about their rights, that they're able to tell people like, hey, I don't want everyone staring into my vagina right now.
Yes. And that's something that, because I precept a lot. I precept students, I precept baby nurses. That's what I do.
What is precept for those who don't know?
So precepting is essentially if a baby nurse comes in and they're in residency, you are basically showing them the ropes, right? And teaching them either how the hospital does it, because you can precept new nurses who aren't baby nurses, who are just new to the hospital.
Right.
And you show them how the hospital does it. And for the nurses who are new to the field, you show them how it works, right? How nursing works.
Yeah.
But I always strive to first give my patients that choice
Yeah.
and the privacy. Hey, I have a student with me. Are you okay with them being in the room?
Love that.
Or, hey, I have somebody new with me. Are you okay with them being in the room? That's always something that I always ask my patients before I allow them to just stay in the room, because not everybody's okay with that, especially on the younger side. The older, I see that the older community, they're okay.
They get it. Mm-hmm.
Let's learn. Some patients be spraying wild eagle, okay?
Okay, ready to go.
You can see everything. But like, you do have to give those patients that opportunity to choose if they want somebody in the room.
So, new question.
Mm-hmm.
So, there's different types of genres of nurses. You have your OB nurses, ICU.
Mm-hmm.
In your opinion, what's the difference between the different sectors as far as nursing? Do you feel like any particular nurse has a harder time?
In what sense?
Like their workload or their case and their stress levels would be generally higher?
If you're talking about level of workload,
Mm-hmm.
you're going to be talking about level of care, right?
Okay.
So if you're in the ICU, you're critical care. If I'm in like acute, where I was before acute surgical, if something go wrong, I send them to the ICU.
Oh, okay.
Right? So if you're in the ICU, that's critical care.
Gotcha.
Like that's the highest, almost the highest level. That is the highest level of care.
Yeah.
Right? So I think those mentally, ICU nurses have it harder in the sense of what all we have to think about.
Yeah.
Right? I've been in the assisted living facility. I've been on med surg. I've been on surgical.
Oh, I love
and now
that.
I'm in ICU. So I've seen the different aspects of what I have to think about during each level.
Yeah.
Right? I'll give credit to the assisted living, the memory care units, right? You're dealing with people who are demented. Right? So physically, it's harder. Right? But when you're talking about mentally as a nurse and what we all have to think about, ICU takes the cake. Yeah.
Because again, like you touched before, it's like separating who you are in the matrix of the hospital versus in the matrix of outside.
Yes.
So how do you leave it at the door, so to speak, when you leave?
So I think it kind of comes out depending on the connection I have with the patient, right?
Mm-hmm.
If I have a patient who like my grandma, what's up, grandma? Right?
Yeah.
I'm talking to them like I would talk to somebody who's older with respect, but we have our jokes here and there. It also brings comfort to that patient, right?
Yeah.
So when I'm talking to them and there's something that we can relate on, I know that my patient knows that I'm really caring for them, right? And I know that my patient will trust me, right? It makes the care easier too. Now, if I had somebody that I can't really relate to, just gonna be nice.
Yeah.
You ain't gonna see my full personality, but I'm gonna be nice because that's me too. I'm a nice person. So being myself in its entirety may not come out with that patient.
Have you ever had a patient refuse care from you due to your race?
Not to my race.
Okay.
It was actually, I did. But I think it was something that more of a misunderstanding. Sometimes people don't understand my jokes. That's just that. People don't understand my jokes.
Right.
And I think that's what happened. But that's the only time I've ever been. I've only been refused once.
Okay.
And that was the only time.
Amen to that. Yeah. Because I just imagine, we're going to play a game later today, but I just imagine like being in a hospital and you're the only one there on your floor late night and them just waiting for a doctor. Because I feel like you see these nurses 6-4 times before you see a doctor spin the block. And I wonder, I'm like, if the nurses are doing all the triage and the doctors writing their clinical notes or waiting for exams to be done and reading the exams, I'm really curious, like, what do doctors do during residency? Like,
So
what are
here's
they doing?
Here's the thing. We may see 5-6 patients, or we may see in the ICU 3 at max. But the doctor on the floor of the ICU has the whole ICU floor.
Oh, wow.
Right? So whereas there's multiple nurses doing the intricate stuff, which makes sense. We're doing the intricate stuff, the deep stuff, whereas the doctor has the whole playing field, right?
Woof.
So they don't have 5-6 patients.
Gotcha.
So to an extent, I understand that. Doesn't mean that the level of care should be adjusted because of that. Okay. But I feel like doctors from the outside, it looks like they don't do much.
Right.
But there's almost, and I tell this to the people that I precept, there's a level of thinking that isn't spoken about, right? We don't talk about our full thought process, because it's hard to articulate how we think, how nurses think when we're going to patient. You have to think about so many things at once.
Mm-hmm.
And if you think about it, if you're on the level of actually treating the patient, you have to think about so many different levels at once. I can't give this medication because their kidneys are failing.
Right.
But I have to know that I can't give this medication. Yeah. That may be my favorite medication to treat patients with.
Right.
But now I have to find something else.
Right.
And this is off the dome.
Right.
This isn't on let me go research.
Mm-hmm.
This is off the dome. So it's just like, we don't know that, all of that. Granted, we know to a certain extent, but we don't know all of that. So I feel like there's a certain level of thinking that doctors do that, and same thing with nurses, that nurses do as well, that we can't really articulate until you're actually doing it.
You're like their right hands
and
their back.
We're their eyes, their ears. We're literally everything they rely on the nurses. And it's just like, that's why it's so much pressure on nurses as well, because we can't miss things.
Yeah.
We are consistently, always, repeatedly assessing our patient. And it's like, I'm assessing you without even you knowing I'm assessing you. Right. And like, it's hard for me to turn off. So I'm always like assessing, always, everywhere I go.
Would you say that doctors take care of their nurses and staff administration? Where does that flow go?
What do you mean by take care?
Because you mentioned that when you precept that you're usually teaching nurses how the hospital works. Yeah. So in my mind, I'm assuming that each hospital goes by different guidelines. Yeah. So do you feel like there's a equal support when it comes to administration and doctors?
It depends on the hospital. I think that solely depends on the hospital. You'll have hospitals where they are so physician-centered, where they let doctors get away with murder in how they talk to their nurses.
Well, it did.
Right.
No shade, no tea.
But
allegedly.
You'll have, I never worked at Red Wellington. I did not work as a nurse in any hospital in Florida.
Yeah.
But so I think it depends on the culture of the hospital, and that's really important. And that's also important when finding the right hospital that's for you. Because some people, like me, I've never been talked to sideways.
Yeah.
Like that. Yeah. From a doctor, like completely and utterly sideways. And I wouldn't allow that. I wouldn't allow a doctor to just talk to me sideways, because at the end of the day, you don't write my checks. We're peers in a sense, right? So, and you're not my manager. We're peers. We work together for the same
You need me,
goal.
I need you.
Yes.
Exactly.
So I don't really condone that. So I wouldn't allow a doctor to talk to me crazy. But I've heard stories of doctors talking to people crazy.
Yeah. I think about the story that happened in our hometown at Palms West, February of 2025.
That's where I was born.
Yeah. You were born there?
That was the hospital I was born at.
Yeah.
Yeah.
Crazy.
Yeah.
So for those who don't know, Layla Lalal, a nurse who was there for 20 years, was brutally attacked by a Baker Act. Someone we went to school with, by the way.
We did?
Yeah, he was a year younger than me, 2 years. You were at your other school by then.
Oh, wow.
Stephen Scantleberry, say his name.
Period.
And my sources informed me a little 2017 that he was always weird. Yeah. So that mental health is real. And it jarred me because at first I thought she was attacked outside, like when he was on Southern. No. But I found it was on the 3rd floor of the hospital. So I'm like, this man brutally beat her to the point where I think she had surgery, but they're not quite sure if she'll regain vision in her right eye. Beat her down, went down 3 flights and got on to Southern.
Able to get out. I think that's what gets me. She was able to get out of the hospital.
But I'm like, I'm sure someone heard her screaming. Like, where's the other nurses on the floor? Where's security? Where are the doctors? Where are the men? I'm sorry, we could bring sex into it, but I don't understand how it escalated that fast and so quick. And he was able to get that far. Like, that's where I'm like, where is the hospital? Where's
That goes back to the staffing issue too, right?
Mm-hmm.
That goes back to that. And also, when you're dealing with patients that are 1013 is what we call them, Baker Acted patients.
Okay.
Or 1013 patients or who have history of violence, right?
Mm-hmm.
We don't know when it's going to happen.
Yeah.
We don't know if it's going to happen. You walk into that room, and that's why we're trained to have certain measures that we take, that we implement when we're walking into the room. We have to make sure we don't have certain things on us when we're walking into the room, right? So it's just like, it could have been something very minor that set him off, right? Mm-hmm. And it could have been some that she did, like your common talk that could set him off, right? We don't know. However, it's unfortunate because a lot of times we are let down. Mm-hmm. These hospitals don't do enough for us to have the support that we need when we are going into those rooms, right? Nurses do not have that support. in these hospitals, especially these HCA. Okay.
What is the HCA hospital?
So different hospitals own, so different companies own different hospitals, right? HCA is the company that owns Palms West now. They did not own it back in the day.
It's a DSO? Or I'm thinking dental terms. So it's a corporate bot?
Yes.
Oh,
so they
Lord.
own these hospitals, right? Yeah. They own these
Capitalism,
hospitals.
I'm shook.
Because they have hospitals in Orlando. They have hospitals everywhere.
Yeah.
They're actually, I found out, and you know, I could be wrong, but I heard that they are the largest corporate that owns hospitals.
Wow.
Yeah.
That's
HCA.
crazy.
And it's a known fact that HCA hospitals ain't.
Wow. Palms West used to be the best in like
it used
the county.
to be. It was before HCA bought it out.
Wow.
They were not always the HCA. When I was in Wellington,
Yeah.
when I lived in Wellington, they were not HCA owned. They were not an HCA. I did my clinicals. When I was in high school, I did my clinicals at Palms West. It was an amazing hospital. It was an amazing hospital. And it's just like, and to find out that they're not even equipped for the type of patient that this guy was.
Yeah.
They were not equipped. Yeah. So it's just like, when does nurses' safety get thrown out for money? Yeah. Because that's what you're keeping them for.
And the CEO, what was his name? Dr. Jason Kimbrell, say his name. On the 911 call, he was saying how he didn't really care. He's like, oh, I don't really care about that. I care about getting the Baker Act dealt with. Talking, and I'm just like, wow, you're a nurse who put in 20 years, who's saving lives, and that's where the priority.
That's the problem. It's reflected in the pay. It's reflected in how they were treated. Mm-hmm. It's out there for us. Yeah. Repeatedly. Like it's out there for us.
I get it.
They show that nurses don't mean much to them.
Especially during COVID, because these nurses were like frontline, I felt like a little bit more than the doctors.
Frontline. Yes, absolutely. Because just like it didn't change. Yeah. It didn't change where the doctor comes a little bit more in the room. Yeah. Anything, they probably in there a little bit less so they don't catch COVID. You get what I'm saying?
Right. Mm-hmm.
So it's just like, who's taking care of those patients? Every hour to every minute. Like, it's us. It's the nurses.
Absolutely.
We're the ones in there.
Do you feel like that frustration is more a reason why more and more people are becoming travel nurses and either making their money and just leaving the field altogether?
Everybody wants to leave bedside.
Yeah.
There's a reason for that. Everybody, there's not a nurse that I know that says, I love bedside. I've never met a nurse that said, I love bedside.
And bedside is directly one-on-one patient care?
Bedside is yes. If you're in the hospital working with patients, that's bedside, right?
Wow.
So a lot of people want to leave bedside. The people who go to traveling, they're like, I'm going to make my money worthwhile, right? Yeah. So they go traveling. And granted, those rates are in the toilet now too.
Wow. Yeah, they caught on.
Yeah. Social media.
Yeah.
But yeah, those rates are in the toilet too. And then you want to add to the fact that I believe it's a female dominated.
Yeah.
So of course we're not going to get the pay that we deserve.
Of course. And especially with now the changes with DEI. And what did DT do this week? He cut out the Board of Education.
Yes, he's trying to. Yeah.
Well, so now I'm wondering funding wise, because I'm not sure if hospitals are funded as well from the state. I think they are. Some of them are. I think
so. Some of them, because there are private hospitals and then there's public hospitals.
Right.
So the hospital that a lot of hospitals in Atlanta, like the ones I work for, they're more private.
Okay.
And then you have your public hospital, like Grady is a huge public hospital. So
yeah, and even just to circle back on what you were talking about, nurses wanting to leave bedside. I imagine bedside is what people like me need. And like,
if you're going to the hospital, that's a bedside nurse.
Yeah. So I'm wondering, like, if they all leave due to these conditions, like what's going to happen to the general population?
I mean, think about it. There's already a nursing shortage. It's just going to continue to grow.
Yeah.
And then what's going to happen? You're going to put more on the nurses that are there. Then you have burnout.
Yeah. I swear every industry I talk to, people are burnt out or like there's not enough people. But I'm like, but people are also looking for jobs. So I'm like, what's going on, Craig? Something's going on.
Some people look at it like it's not worth it.
Yeah.
And I'm going to go through all these years of college. I have a degree. I'm smart. I know what I'm talking about. To be going there and be beat down.
Yeah. Mentally and physically. I get it.
And then you turn around and this poor woman gave 25 years of her life to this profession.
Yeah.
And probably the same hospital. And to be talked about like that.
Insane.
This hospital wouldn't exist without nurses.
It's true. It's true. I'm going to share a short little story time with you. The first time I ever ended up in a hospital, working at Forever Slaving, RIP, because now it's done.
Right. I remember when you worked there.
Yeah, right? I was there for a hot minute, too long. There was a nurse who came in, right? Now, mind you, she was older, middle-aged nurse or whatever. She wanted to return like a pair of tights that were like on sale. Usually I'll be like, all right, whatever, I don't care about this job. But I guess that day I wanted to do my job and be like, I'm sorry, ma'am, I can't return them. They're like $2.
Yeah.
And now that I saw she was nurse, I'm like, girl, I know you got it. It's $2. So like I was up and down. She tried to cuss me out. I barked back. I'm like, I argued this woman down. You can't return these tights, right? So I ended up in the hospital due to like hemorrhaging.
Yeah.
So my blood levels were like 5.1. So, I was like to be like dying.
Yeah.
So I needed blood transfusions and stuff like that. And I walk in, and it was right across the street at Wellington Regional. I walk in, girl, this happened 2 weeks before. The nurse that I was cussing out at the counter was my nurse. And I was just like, Mom, I said it, my Creole was A1. I was like, Mom, back again. Don't leave me here. Mom, please. And I didn't want to tell her what was going on. I was like, Mom, please don't leave me here. I'm going to die. Like, this woman will hurt me. And when I tell you, the bitch that I spoke to at Forever 21, she was like, hi. And I'm just like, who are you?
Because at the end of the day, we have a job.
Yeah.
And if you really love what you're doing, patient can cuss me out. I'm still going to take care of you.
Yeah.
I'm still going to do my job. You have the right to refuse if you want to refuse. Yeah. Cool. But I'm still going to do my job.
Yeah. So if you ever see this today, ma'am, I'm sorry. I'm just doing my job. But damn. But I was just like, ever since then, I was like, you know what? I'm always nice to anybody, even if they have an attitude. Because you never know when they're going to circle back and come back to you.
You know, a cop said that to me one time. I'm not going to say where I was or what city I was, but
outside.
I was just outside. And he said to me, I was pulled over. And he was like, I don't give nurses tickets because if I ever need my life saved, you never know. And I was like, I got you, big dog.
Okay.
I got you.
Right.
Yeah.
CPR
So,
right now. You fine? No, I'm just kidding.
Right.
But yeah, like you never know who people are inside and outside the matrix. I'm always kind. I'm like, it'll circle back. It'll come back to me.
Yeah. It's important.
Yeah, it really is. Because it's like, at the end of the day, I feel like nobody really wants to do their job unless if it's their passion. You know what I'm saying?
Nobody really wants to be the bad guy.
Yeah.
Nobody wants to be the bad guy part of the job.
Yeah.
Like,
for sure.
I'll give the glitz and glamour of the job, but the bad part, nobody wants to do that. So if there's somebody's actually doing it, just
live their life.
Yeah.
Okay.
Leave them alone.
So guys, now we're at the time of the segment where we like to play a little game.
A game?
Yes, a little game. A little game I like to make together just to fit the episode.
Okay.
So this game is going to be called Triage with Trisha.
Oh, Jesus.
Yes, ma'am. We're going to triage some patients, some fictional patients.
Okay.
Medical disclaimer. These are all for entertainment purposes. If you are suffering these symptoms, this is medical advice, but this isn't real. Please contact your PCP. Thank you. So we're going to play Triage with Trisha.
Uh-oh.
So first scenario, you have a 35-year-old man comes in with severe chest pain, shortness of breath. BP is 180/100. Heart rate is 110 BPM. Oxygen 92. Side note, I will say he accidentally ingested a marijuana gummy and did not know that. And he thought it was regular gummy bears. So he's probably high as fuck right now, but you don't know that. What do you do? He just tells you he ate a lot of candy and now he's having these issues.
What do you mean? What do you do?
What are you triaging?
So you want to adjust the chest pain first, of course, blood pressure. His oxygen is 92. We're going to put some oxygen on him because it probably will be exacerbated with everything that is going on, but it also helped with his anxiety because I'm sure he's anxious from that marijuana.
For sure.
But that's how we'll go. Airway, breathing, circulation. ABCs,
boom, put it together.
And then that's where you go.
Okay, we getting here. All right, next scenario. We have a party girl. Comes in from a long night. She's suffering from severe vomiting, diarrhea, but insists that she doesn't want to be seen by a woman nurse. She needs to be seen by a male nurse, yada, yada. What do you do during this triage? Mind you, she's violently throwing up everywhere.
So she has two options. She can be treated or she can wait for that male nurse that she wants. The point of it with nursing is we have to lay it out for the patient so they can understand. So I'm gonna tell you, I said we can treat this nausea, or you can sit here and vomit while you wait for your male nurse.
Right.
They have that right. You have the right to have a male nurse. as long as we have a male nurse available, right?
Right.
You have that right. If that's what you want, you have that right. However, do you want to be treated for this nausea and vomiting? You're violently vomiting. Do you want to be treated now, or you want to wait for that male nurse while you vomit?
It's like, get it together, girl. It's taking up the hallway.
Every patient has that right. You have that right.
Okay. All right. Look at her. So professional. All righty. Third scenario. We have a young girl comes in. She shows signs of physical abuse, and her caretakers are vocally combative with hospital staff. How does your triage session go?
So unfortunately, we are mandatory reporters. So essentially, the parents will have to leave that room, and we had to talk to that child.
Oh, nice. Yeah. Okay, I didn't know that.
Yeah.
So when situations happen like that, like where you physically see them, now if the parents weren't combative, would you still ask them to leave the room?
Yeah, those conversations are had with patient and the nurses specifically. And of course, depending on the age, it's easier versus like your babies or your toddlers. And I don't work with kids, so I don't know about that.
Gotcha.
But from school and what I've learned in school is essentially like you have to have that conversation with the child when the parents are not present, because a lot of kids are going to be scared to answer that with the parents present.
Now, is that restriction only for children, or can like
elderly
wives,
abuse?
Yeah.
It's everybody.
Oh,
it's everybody. That conversation is had. And, we have, like, when we're charting, we chart that. Do they show signs? Like, there is specifically a place of somebody if they show signs of elderly abuse or anything like that.
Wow. What are some signs of elderly abuse?
You'll see them. It depends. So if they're with it, you might see that they may be really small, really skinny. And granted, old people, they typically, I don't want to say wither away, but they get smaller.
Yeah.
But, they look malnourished. They're dehydrated. They may have bruises on them.
Yeah.
They may show fear around whoever their caretaker is.
Oh, I see.
One big one is that the caretaker will speak for them when they're completely able to speak, whether it's kids, whether it's adults, whether it's elderly. Right?
Gotcha.
So broken bones.
Okay, that's real. Thank you.
Yeah.
Because I feel like a lot of people sleep on the elderly. It's always like, oh, advocate for children or battered wives, but we got to talk to our elders.
I always look at it as a circle, right? The elderly and the babies. Granted, the elderly are still adults.
Yeah.
But you have to look out for the elderly just as much as you look out for babies, because they are, what's that word?
Vulnerable?
Vulnerable, just as vulnerable.
Yeah. So true. Almost similar to toddler crying for things, my old grandma crying for things.
Exactly.
They both in diapers. It's a circle of life.
Not a diaper.
Because they get there. They get there.
Yeah.
Let me see.
That is true.
All right. Now, last scenario. This is going to be a double one.
Uh-oh.
Old patient.
Yes.
Suffers from dementia.
Yes.
Insists on having a white nurse.
Yes.
There's only people of color in that whole entire hospital.
Yep.
Angry. How do you triage that situation?
You gotta do what you gotta do.
Gotta do what you gotta do.
Yeah, do what you gotta do, while still respecting the patient's wishes.
Gotcha.
And granted, yes, they're demented, but you gotta do what you gotta do.
All right. Same patient now has transitioned to the hospice sector. Yeah. You happen to be there too.
Yes.
And patient admits to a racially charged murder that they committed back in old times way. What's the triage situation there?
That's not triage. We ain't triaging at that point. That patient is admitted. But you have to find out if it's true, because they're demented, right? So you got to find out if it's true. I don't know, honestly, with that. I ain't never been in that position. I don't know.
I'm like, do we report the police?
Let me tell you something. I'm a nurse that's going to tell you, I am not sure. Let me find out. I am not somebody who has all the answers. Don't ask me everything. But in that scenario, I think it's something that you would just, as a nurse, bring up to your supervisor, and they do that. But
gotcha. Now, where do you see yourself in the next 5 to 10 years within the nursing field or outside?
My goal is CRNA.
Okay.
So I'm which is a certified registered nurse anesthetist.
Okay.
They are the nurses that manage your anesthesia.
Oh, okay.
So, yeah.
I'm to anesthesia.
Yeah.
Cash.
Yeah.
I just hear cash. Okay. Sabrina Monae. Money coming.
You know me. I'm not somebody who's complacent. I don't stop. Right. I've been in school by how many times?
I swear.
I done had 3 graduations at this point.
Yeah.
Since
Black women stay educated. We really do.
So it's important that I continue. And again, going back to how I said, we don't want to be in bedside for forever.
Yeah.
Right. So, yeah, that is the goal. So
Okay.
within
I
the
love
next
that.
couple of years, actually, I'll
Okay.
be going back.
Take me under when I get this body done.
Period.
Ooh.
Got you.
Okay. Now, if you weren't in your field, what other field would you see yourself being in?
You know, I've been asked that before, and I absolutely don't know.
No.
But some type of service field.
Yeah.
You
Helping
know,
others.
that's just how I am.
Yeah. Of service.
Yeah.
Okay.
Because we service to all mankind.
Yeah, I love that. Now, service to all mankind. I really think you would actually be really good like hosting and like talking. You're so funny.
I've done hosting before.
Yeah.
Yes,
Do you like
I
it?
have. It was so much fun. When I was in college,
Yeah.
I hosted a fashion show.
Ow.
It was so fun. So much fun. And
Yeah.
I feel like, yeah, I have the personality for it, but baby, I got anxiety.
Yeah. Anxiety. No, I hear you for sure.
Yeah.
So on the Passenger Seat Parlay Industry Insights, I like to wrap up the show where I invite you to put out your energy into the universe and just give a message out to the listeners / viewers of what you want to share about whether your life, your career, or just, basic advice you want to just put out there.
I feel like, should I look at the camera?
You could do whatever you like. Just hilarious. An actress. Let's look at the camera together, shall we?
Okay. I just want to say to all the baby nurses who are people who are thinking about being a nurse. If you're in nursing school, I would say this: it's tough. We all went through it, but it is the most rewarding. If this is your passion, it is the most rewarding field ever. Literally, I love what I do. There's never a time that I wake up and say, oh, I got to go take care of these patients. I may not want to wake up and go to work, but take care of these patients, I enjoy it. It's something that I love to do. So if this is something that you're passionate about, think about that every time the going gets tough, right? Just think about that this is a passion for me and this is what I want to do. And also the people who may feel like it's too late for me, I'm older. Baby, I've only been a registered nurse for a year and I'm 31. I went to nursing school again at 30. It's never too late. It's never, ever, ever too late. And some people I was in school with when I was an LPN were 50 and up. And she just did it because she liked the nurse that took care of her mom.
Oh, wow.
If this is what you want to do, there is no time constraint associated with it. Just do it. It's hard as hell, but you got this, you can do it, and you will succeed, and it will all be worth it. Everything that comes with being a nurse is so rewarding.
Amen. Okay. Yes. Okay. Thank you guys for listening and watching another episode of Industry Insights on Passenger Seat Parlay. And where can the people find you out in the universe?
Okay. You can follow me on Instagram at Sabrina Monae, SabrinaMonae. Twitter, same thing. And YouTube, Sabrina Monae.
Yes, she's a vibe. Follow her there. Bye.